A very good evening to everyone. This is Dr. Apoorva from Faculty of Paramedical Sciences, Physiotherapy Department. Today, we are recording a video lecture on PT management of spinal cord injury. In the last video lecture, we discussed about the types and the classification of spinal cord injury, what actually spinal cord injury is and what are its clinical features along with those clinical manifestations which we see in different classifications. Today, along with that, we are going to study about the physiotherapy management we generally conduct in a spinal cord injury patients. For conducting any spinal cord injury, as we all know, the basic important necessity is the assessment. Assessment is a crucial form which tells us which type of physiotherapy should be rendered, whether it should be preventive, it should be curative, or it should be rehabilitative. When we talk about rehabilitation in center, then PT management of spinal cord injury will deal with all sorts of disability, the symptoms, the architectural barriers, and the major concept which is behind every physiotherapy management is return to normal quality of life. This QOL is very important when we discuss about rehabilitation. The basic purpose behind rehabilitating any patient, whether it is of spinal cord injury or any other injury, is returning that patient to back to its normal quality of life. For this, after this assessment, when we have assessed what the patient needs, the first and primary step is the formation of goals. Goals for any physiotherapy management will conduct of two phases, short-term goals and the long-term goals. So, short-term goals are those goals which we plan for a shorter period of time. Like for example, if I am rehabilitating a patient and I have to see that patient within the time frame of 1 to 2 months, then I will decide that what goals are to be set for the short term and what are the longer term goals in comparison. So, the short term goals here will be sensory re-education of the patient, motor re-education of the patient, and pain or balance, or I should say static balance abnormality treatment. If here we discuss that these short term goals are very necessary to abide by the physiotherapy treatment. Again, short term goals and long term goals depend upon the type of spinal cord injury. That if a patient is having quadra equina syndrome, the rehabilitation will be totally different from that if we treat any other type of spinal cord injury. For sensory re-education, we will have some measures of physiotherapy which we will be discussing henceforth. For motor re-education as well, we will be having some other goals, and for treating pain or static balance abnormality, we will have some other physiotherapy management. For the longer term goals, we will be discussing specifically on coordination, since static balance is in a list of short term goals and it will be the primary basic to turn to longer term goals. We will be turning it into coordination, then balance abnormality, then we will come to gait abnormality, again then we will come to ADL, and then we will come to quality of life. So, as we discussed earlier, every short term and long term goal defines a set of physiotherapy interventions which we need to rehabilitate the patient through which. Sensory re-education, for sensory re-education we give sensory re-education kit. The application of sensory re-education kit is itself a vast topic. For motor re-education, we basically go for strengthening of the muscles, we go for treating the range of motion of the joints, and we also go to prevent the muscles from wasting. Now, if we talk about sensory re-education, while sensory re-educating the patient, we will need a kit which will have different types of materials which could enhance the sensory domain, or which could treat the sensory abnormalities in a patient. While we are seeing a spinal cord injury patients, there are many at times sensory deficits being prevalent in those patients. So treating those patients with different type of modalities, for example touching the patient with different type of clothes and handling them with different types of sand, telling them about the different colors, these go under sensory re-education techniques. Now for motor re-education, when we'll talk about motor re-education, we'll talk basically about treating the spasticity or flaccidity. This again depends on the case study or the patient of spinal cord injury we are treating. If the patient is spastic, we'll apply methods to reduce spasticity, and if the patient is flaccid, we'll apply methods so that motor tone is enhanced in such patients. For spasticity, we can use icing, we can use stretching, and we can also use splinting. Likewise, for flaccidity, we can always go for stretching. To induce motor tone or to enhance motor tone, we can always use icing and positioning. So these physiotherapy managements will depend on the case or the patient, whether we have to reduce spasticity or whether we have to induce increase in muscle tone. Again, motor education after treating spasticity, flaccidity will come to joint range of motions. Joint range of motions could be treated using passive range of motions if the patient is directly dependent on us, and it can also be treated using active assisted range of motion exercises, which we'll render if the patient is not purely dependent on us but is partially dependent on us for the movement. Again, to prevent muscles from wasting, we have to apply proper positioning of the patient and proper movement of every muscle so that the patient does not have any muscle wasted. Whether we'll see the patient in acute condition or subacute condition or the chronic condition. Now, for reducing pain or static balance abnormality, we will treat the coordination of the patient, which again comes to the longer goals. So this last goal of short term and long term will go in coordination or simultaneously. For treating the coordination of patients, we can apply different cognitive exercises that will ask the patient to reach to a particular height or to reach to a particular length and grasp an object. So in this course of exercise, the patient is getting involved. The patient is not understanding that yes, I have to perform a certain set of exercises, and the patient is unknowingly treating the coordination abnormality as well. For balance exercises, there are many treatments which can undergo balance treatments. Now, training of balance is very important in especially cases of spinal cord injury. If we have to return the patient to its normal quality of life, balance, gait and ADL play a very important role. Treating the balance would be very easy if the patient is not purely dependent on us or partially dependent on us. For treating balance, we can always use parallel bars. We can use wedge bars. We can then use we can then go on to sit up and reach exercises. We can go for further strengthening exercises, or adding to it, we could go for single leg standing. after a patient has been trained for single leg standing and the patient is able to maintain its single leg support, then we will transfer the patient over the gait training. For gait training, once the patient is quite stable through the single leg, we will train the patient to walk by themselves, firstly with minimal support and then independently. For gait training, we will ask the patient to first walk normally on parallel bars or whatsoever surface you are having for treating that patient. Secondly, we will further enhance the activity and then we will ask the patient to do hurdle walking. What is hurdle walking? When we introduce any sort of hurdles in front of patients while they are walking normally, it prevents them to combat their fear of fall and to train their cognitive abilities as well, so that they can walk properly and normally during their lifestyle. Again is figure of 8 walking. What is figure of 8 walking? Figure of 8 walking basically helps the patient to turn independently, to walk independently and to train all the muscles, core muscles along with the cognitive abilities, so that patient does not have the fear of falling and there are lesser chances of the patient that he or she might fall while training or while adopting it into their normal lifestyle. Again, after completing this gait pattern, we can improve ADL by various activities which we could give as home exercise programs. For example, if we ask the patients to do prehension activities or we ask the patient to do power grip activities, it will only enhance the activities of daily living which the patient is used to do in their normal life. Then quality of life. A mixture of these all activities is summed up as quality of life. Enhancing quality of life if any patient is cumulative of these all physiotherapy managements. Now, we have discussed here the basic physiotherapy management required to treat or rehabilitate a spinal cord injury generalized patient. There are various other modalities or advanced techniques which help us to rehabilitate the patient, which we will be discussing henceforth. Thank you.